Good evening, everyone. I'm Paul Kagabine with the Garland County Library in Hot Springs, and I'm here this evening to once again discuss the ongoing COVID-19 pandemic with Dr. Gene Shelby, the Garland County Health Officer. Welcome back.
Nice to be here. Thank you.
So this is the second in a series of virtual COVID-19 updates that the library and Dr. Shelby hope to try and bring to you every few weeks, as long as the virus remains a serious issue. And in fact, the next day after tonight is going to be Thursday, November 19th at 6 p.m. For the audience, if you're watching live, get those questions submitted in the comment feed, and Dr. Shelby will try to answer as many as we can get to. They can be about anything from symptoms to treatment to prevention and projections and more. But first, I believe Dr. Shelby would like to start by giving us a progress report on the current state of the virus since we last spoke earlier this month.
Okay, thank you, Paul. I'd like to kind of give a little background. I'm the Garland County Health Officer, which is a voluntary position, kind of recommended by the county judge and approved by the state health department. I'm not an employee of the health department, but I've worked closely with the state health department for many years. And of course, this year has been a very different thing for a lot of people, but especially people at the health department. We have the state health department in Little Rock, and then we have our local health unit here, and both of those entities have really had a busy year and really kind of stepped up to really help protect our community. That's what the public health issues are about, is protecting and in many cases preventing illness within our community. One of the things that we did here in Garland County in the first week in March is the leadership of the county and the city of Hot Springs created a task force about the coronavirus, and we started meeting, like I say, around the first week in March, and we continue to meet on a weekly basis on a Zoom meeting every Monday morning, and we get input from the political leaders, from the city director or city manager Bill Burrows, and County Judge Daryl Mahoney, as well as our fire chief and law enforcement. And then we have representatives from the two hospitals that also participate, and we have representatives from the Hispanic community that participate. And over the last couple months, we've had the school superintendents in Garland County also participate, and we have a discussion of what's going on. And I usually present a report of how we're doing in terms of our numbers and then some ideas that we can go forward to do what we can in Garland County to try to manage this terrible pandemic that we're seeing. And kind of in broad terms of what we've experienced in Garland County since the 1st of March, when we've had our first cases here, we've seen Garland County has really kind of risen to the occasion in many cases in terms of setting up testing and screening. And we had a very mild number of cases through March and April and May, and then we started having our peak after Memorial Day, and then another peak after the 4th of July, and that has been our highest number of cases, was starting in mid-July going through the month of August. We have been on pretty much a plateau as far as our number of new cases. We have increased our testing, so our positivity rate had been on a decline, and our active cases had really kind of plateaued. But over the last 2 weeks, since we met here, we've had some new issues develop in Garland County, and we have seen a significant spike in our cases, our active cases, as well as daily positive cases. And over this past week. Like I said, on my report that I give to the task force on Monday morning, it's based upon our figures on Sunday evening. And this past week, that ending Sunday night, we did see a significant increase in the number of new positive cases. We had been down around 20 new positive cases per day, and we were up to 20, almost 30 new cases a day, and our testing had gone up some, but our positivity rate had also gone up, and so we're I'm not sure that we would say that we're in a second peak. We're still a little bit, having a little bit increase in our numbers, but it hasn't been, significant. But we really have identified some real, troublesome, bothersome trends in Garland County, especially over the past 2 weeks. We now have at least 3 of the nursing homes are true hotspots, and we're seeing marked elevation in the number of cases at these nursing homes, and also a marked increase in the number of positive cases in our healthcare workers in the county, and the vast majority of the healthcare workers that have tested positive do work in our nursing homes, and that's, unfortunately, that this is an issue that seems to be accelerating. I know that the state health department is working closely with the nursing homes to do what we can to kind of ameliorate some of this increased cases of infection. One of the things that we also trace and that I report to our task force is the breakdown of our active cases in the county by age. And this is again a very bothersome trend that we've had, in that our percentage of our cases in the over 65 has really skyrocketed, and it's much higher than the average around the state. For the extent of the pandemic, the percentage of cases in the over 65 on statewide has been like 13, 14, 15%. We've been above that in Garland County for a number of really months, but over the last 3 or 4 weeks, we've seen a marked increase of that. In the week ending October 11th, we had 25% of our cases were in this age group. That went up the following week to 33%, and this past week ending last Sunday, we're up to 43% of our cases in this age group, and that represents, at that time, 99 people in this age group were infected, and we've seen through this pandemic that those are the most vulnerable for really severe disease and death. 2/3 of the deaths that have occurred in Arkansas have been in this greater than 65 age group, and so I certainly see that this is going to be a continuing problem for us, and something that I think we're all aware of and trying to plan for. Fortunately, at our meeting on Monday, the hospitals reported that they're seeing some increase in the number of COVID cases, not necessarily the ICU ventilator cases, but an increased number of people that are sick enough to be in the hospital, and so we're monitoring this very closely. Of course, the hospitals do have contingency plans should these numbers increase, and deal with it, so that I feel real confident that the hospitals are really on this and are going to be able to support what we need to do in the county. Another issue that I wanted to kind of talk about a little bit tonight is about one thing is the flu season. We're into the flu season. I noticed in the paper today we had the first death in Arkansas from the flu, and this is really going to be a potential hazard as depending on the severity of the flu and in terms of having it with the COVID at the same time, because the symptoms are very much similar. And so anyone that has the flu or flu-like symptoms are going to be, there'll be a concern that they have COVID, and so that's going to be, really going to be need to test and really isolate and quarantine people, and it may turn out that they just have the flu. One of the things that Dr. Delahaye at the State Health Department, and who's kind of in charge of the flu outreach program, has warned that we need to remember that last year we had it wasn't a terrible flu season, but we had significant disease, and we had 120 people die from the flu last year, and we had over 1,200 people that were hospitalized with the flu. And so if we have a bad flu season on top of the COVID, it really could strain our resources and also cause really severe disability and death. So that's something that's why the push this year for flu vaccination is greater than it ever has been. And we can't emphasize it enough that the importance of getting the flu vaccine. We've had the flu vaccine has been around for a long time. It's a very safe vaccine. It does have variability in terms of the effectiveness. That tends to vary from year to year because the flu virus does mutate, and they have to develop the vaccine based upon the flu outbreaks in the southern hemisphere, and try to do the best projection of what they think that the main strains in the northern hemisphere is going to be, and get that flu vaccine developed and out. It's unfortunate that an average year in Arkansas, only 50% of the people take the flu vaccine, and it's very safe, and it's doubly important to get the flu vaccination this year. And there's many places to get the flu vaccine. You can get it through our health department, our Garland County Health Unit on Malvern Avenue. Certainly, a lot of the doctor's offices provide that, and then the pharmacies. So there's ample opportunity to get the flu vaccine, and it's doubly important this year. Another thing that we hear a lot of discussion about vaccinations in general, and what we're looking towards is that having a vaccine for the COVID-19 virus, and then certainly that's being worked on and developed, developing all around the world to get to that point. And it's hard to, and I certainly can't predict when that's going to occur. I think probably sometime in the first half of 2021. But there's a lot of issues around this vaccine that will be developed, and because usually it takes years to develop a new vaccine, and that time frame is being compressed this year because of the urgency of the pandemic. But one of the things that when it takes a while to develop a vaccine is number one, you have to make sure it's safe. You don't want to come out with widespread vaccinations, and it turns out that there frequent severe side effects, and so that's one of the real crucial things in the development of the vaccine, is to make sure that it is safe. The other important aspect of a vaccine is to make sure that it's effective. People don't want to, get a false hope that this is going to help if the vaccine that is developed is not really effective in preventing the disease, and so that's part of the investigation and development of a vaccines to make sure that not only is it safe but it is effective, and this is kind of a really uncharted territory. With a global pandemic such as this, and developing a vaccine on a accelerated time frame, because even if you have a rare adverse effect, a severe adverse effect, say someone actually dies from the vaccination, and that with the fact that there are going to be several billion people getting this vaccine, that even if you have one fatality in a million vaccinations, that adds up to thousands of people dying from the vaccine, and for something like this, you're injecting kind of a foreign material in somebody's body, and people respond differently, and we know that there will be some adverse reactions to this, and we want to make sure that the vaccine that we do develop and do get into circulation is safe and effective. Another kind of good thing about the discussion of the importance of the vaccines is that we've seen over the last few years people being skeptical about vaccines, and that's why we see that turns up in the low use of safe, effective vaccines like the flu vaccine. There was a very good article in the Journal of the Arkansas Medical Society this month, in talking about vaccinations in general. And one of the kind of disturbing things that has occurred with the pandemic is that some of the routine vaccinations that for especially childhood vaccinations, we've seen a real drop off because people have either put off or didn't want to go to the doctor's office. And it was reported in the article that from the time of the onset of the pandemic to now, that there were 75,000 fewer childhood immunizations than there were during a comparable period of last year. And this is a real disturbing thing, and it's one thing that the medical community is really trying to address, as well as the state is trying to make it better and more cost effective for office practices to do the vaccinations, the childhood vaccinations. One thing that I thought was very interesting is that one of the kind of main standing childhood vaccination is the measles, mumps, and rubella vaccine, and that's part of a normal childhood regimen of vaccines, and that the disturbing thing is that these vaccinations aren't being given because for a variety of reasons, and that the measles infection or measles virus is 6 times more contagious than the COVID-19, in which we know is a highly contagious, and we don't see that much measles today because we have widespread vaccinations, but measles can be a very serious, deadly infection for a child. So that's something that we need to really keep in mind, that vaccinations are important, and we've got some good vaccinations, but they have to be done properly in order for them to do what we want them to do. Let's see, there was a couple other, we've got vaccinations that are established vaccinations for everything from the whooping cough to the pneumococcal vaccines, the vaccines against shingles, These are all very important, very safe, and important vaccinations. So I'm hopeful that that with the discussion and concerns about vaccinations, that people will be more vigilant about making sure that they get the vaccinations that are available and effective and need to be done. So those are some of the important issues that I see. One thing that I became aware of just within the last couple of hours is that the state came out with their daily briefing on new cases, and Garland County had over 100 new cases added to our database just in the last 24 hours, which is more than we've ever had. And I had a chance to look briefly at our database of our active cases in Garland County, and a very significant number of these are from the nursing homes, both nursing home residents as well as nursing home staff. And of course, the state is really upped the testing in these facilities, especially the ones that are showing high rates of infection. And they're testing it up to 2 times per week of all the residents and all the staff. But this is a real serious turn of events in our community, and we really need to kind of really recognize the healthcare workers in these nursing homes. It's a very difficult environment to work in. You've got your nursing assistants, your nursing aides, and the nurses and the doctors working in these nursing homes. And once one person mentioned to me earlier this week that kind of surprised that the healthcare workers are getting infected because when they've gone to the doctor's office, everybody takes precautions and it don't see why that the healthcare workers are at risk, but it's a whole different ball game in these nursing homes, and we really need to recognize, especially the nursing aides. Their job is a difficult job, even under normal circumstances, dealing with cleaning and feeding a patient with multiple medical problems and frequently with cognitive disorders, dementia, Alzheimer's, and you kind of imagine what it's like to deal with these kind of patients that are infected with the COVID-19 and trying to care for and take care of the patient and try to stay safe yourself. So I think it's not surprising that we're seeing the increased number of positive cases within the nursing home caregiver field, because their job is so dangerous and fraught with the potential of them getting infected. So that's the kind of issues that I've been working on, and happy to take any questions.
Thank you. That was very informative, and I'm glad you covered the healthcare workers, because that was a question I did have. You did mention how the hospitals are doing also, but that's something I want to put some emphasis on. One of the most alarming figures we're hearing about around the country is how many hospitals and ICUs are starting to become overwhelmed and reaching capacity as we get deeper into fall. Wisconsin is one of the worst examples. They recently reported having to open a field hospital. Are you confident we won't reach that level of urgency?
There's always
is there a chance we might?
Kind of concerned that might happen. We don't see any signs of that at this point. We have plenty of capability to manage the cases that we do have. Certainly, when we're seeing the number of new cases in this older population, with comorbidities, it's not much of a stretch to see that these people very well could end up in the hospital. And our 2 hospitals, they're not just for Garland County. They're regional hospital for a good portion of Southwest Arkansas. But based on where we're at now, I think we're in good shape, and the hospitals are definitely making plans in case they do have a surge in these patients. One of they've got plans to expand their ICUs into other areas of the hospital. One of the kind of real dilemmas, though, is making sure they have staffing for this, and because it's a different type of work than say in an office practice. But I know that they have contingency plans and are monitoring it very, very closely.
We are starting to get some questions in from the live viewers. I'll give everyone watching live a few more minutes to get those in. But I did get some questions in advance, which anybody watching now is welcome to do next time. Brian asked me, do we know why people react differently? Around a third don't even know they have it, while it hospitalizes
Well,
or kills
that's true
others.
pretty much of any kind of infection. It's going to affect different people differently because of everybody's makeup is different and respond to infections differently. And that's one of the real challenges of this particular virus, because there is such a range in responses to it. Everything from a significant percentage of people being asymptomatic to a significant portion of people being very, very ill. And the fact that this virus has been around and known for less than a year. There's certainly been studies and ongoing studies around the world to try to understand it better, and I think that we are getting a better understanding and getting better at treating people that do have severe infections from it. But it causes such a variety of things. It's certainly mainly a respiratory infection, but it also seems to have some effect on blood clotting. They're seeing micro blood clots in different parts of the body in people that are infected. There are, the people, the symptoms, can vary. There's just kind of, achiness. And, one of the things that I've never heard before is a virus that kind of really inhibits the ability to taste and smell. I don't know that that's understood why that would happen. It's a very unusual thing from an infection to cause this. So it's I think we're learning more on a daily basis. But it's a new virus. It's not like the flu or even the bacteria that cause pneumonia. They've been around and been studied extensensively for a long time. So it's a challenge to understand the virus, but learning how to best manage people that do have significant infection.
Yeah, I personally know someone who had it about a month ago, and they said they still haven't recovered their normal sense of taste. It seems like it's
even with a kind of a wide range of symptoms. Some people, even healthy people that really didn't get that sick from it, it continues for weeks and months, really not feeling back to normal, and it's that's kind of one of the manifestations of this infection.
I also received a couple questions from Chaz. His first one was, how does the flu vaccine affect COVID?
Well, they're totally different, viruses, and the flu vaccine is specific for like this year's flu virus. The flu vaccine does not help you develop any kind of immunity to the COVID virus, but as far as the treatment and diagnostic of it is that with the symptoms, at least initial symptoms of both the flu and the COVID really overlap. That if you go to the doctor with the symptoms of a cough and fever and sore throat and not feeling good, you've got to be tested for both, because the symptoms are so similar. But as far as the vaccine, again, the importance of the flu vaccine this year is that it will reduce the number of people that have the flu, and so that, because that, by reducing the number of people that come down with symptoms of the flu, you're reducing the number of people that have to be considered as possible, being infected with the COVID. One of the things that I think there's hope that with all the things that we're doing with facial coverings, social distancing, things that we haven't done in the past, that these things will improve our ability to prevent the spread of the flu, and subsequently we may have a milder flu season this year. Again, of course, everybody's got to do these things for that to be effective, but that's one of the kind of hopeful things, or one of the good outcomes of people wearing masks and being more conscious of their surroundings.
His question kind of made me wonder, can the same person have both the flu and COVID at the same time?
Yeah. Yeah, and anyway, you get the flu, it doesn't guarantee you don't get COVID, and vice versa.
Chaz also asked, and you may have touched on this a little in your briefing, but progress on a COVID vaccine and side effects from that.
That's certainly, it's very. I know that they're doing some of the kind of think phase 3 testing of this, and again, they're being very, very cautious. So I know of one group that's developing it. They had to kind of stop it because somebody did have a pretty severe reaction to it. So that it's a lot of smart people really working hard on getting this done, and some of it is just going to take some time.
Got a question from Shannon. Is the population safer now than it was earlier in the pandemic? That's a tough question. I think for people that actually get the disease and have severe response to it, I think that we are getting better at our treatment modalities for the virus, and determining what things we need to watch for. Even if someone that needs to be on a ventilator, there's more knowledge about how being on a ventilator affects people with severe COVID infections. So I think from a treatment point, we are better off. But as far as as far as the number of cases, we're in the United States, we're up about as high as we've ever been. So the amount of infection and people that are infected are out there, I don't think we're any better off. And there certainly, we've had so many people that have recovered from the infection. So at least potentially, this group of people would be immune to getting it again. But again, with this being a new virus and still being studied, we don't really know if you're protected long term or forever, or not. And again, with the new virus, it's just going to take some time to kind of get those answers. Kind of in the same vein, have we seen the virus mutate since the beginning?
Yeah, the virus has mutated some, but from everything that I've read, it has in a significant manner, in that the virus is still pretty much the same as it was, though there are different strains, but from what I know, the mutations haven't been significant enough to really make that much of a difference.
That's good news.
Yeah.
We have a live question from Mary who asked if testing is up.
Testing in Garland County, it really kind of spiked about 6 weeks ago, and I think a lot of that was when the health department was coming into the nursing homes and doing really surveillance testing. They'd come in and test everyone, the staff as well as the residents on a regular basis. I think some of them were doing 2 tests per week, or testing everybody twice per week, whether they had any kind of symptoms, whether they had a contact or not. So that when that went into effect, since we do have a number of nursing homes in Garland County, we saw our testing numbers go up significantly. We were seeing maybe 1,000 tests per week, and we went up as high as 4,000 tests one week, and now we're kind of settled into the 2,000 to 2,500 tests done per week in Garland County.
Casey asked, is the higher number of 65 and up because of the nursing home hotspots?
I think that's a significant portion of it. Though we were seeing that some even before we developed these really hot spots, and I think some of it, of course, we've got a higher percentage of elderly population in Garland County, so some of that might be some of the factors that caused it. But we've had this kind of increase over the last really two months or more. So it's not solely because of the nursing homes.
A few questions from Susan. Her first one is, what is the rating of our COVID units?
I'm sorry, I don't.
The rating of our COVID units.
I guess I don't understand that.
I'm not sure, Susan, if you can clarify, please do so. Her next question was, are they taking nursing facility patients with dementia to hospitals or treating within nursing facility?
Well, it really depends on the severity of the infection. They certainly try to manage these, and again with the kind of wide spectrum of how the infection is affecting the individual patient. They certainly try to do everything they can to keep the patient in the nursing home. But once they develop, some unstable vital signs, that their oxygen level starts to diminish, the capabilities for treating at the nursing home are certainly a lot less than you can in the hospital. And so in cases like that, the patient is transferred to the hospital for more intensive treatment.
She also asked, if you suspect you had the virus several months ago, like 8 to 10 months, can a blood test show it still now?
Yeah, I mean, you do the antibody test, and an antibody test will give you some indications if you had the infection and your body has produced these antibodies. Again, with it being a new virus, it's not clear, how long these antibodies are present in your system, whether that diminishes over time. That's frequently the case when you have other types of infections and your body develops antibodies, that you'll have a kind of a falling off over a period of time as how much antibody you have in your system. One thing about that, though, you can measure that, but your body has the capability that once it has developed an antibody to an infection, that if you get kind of reinfected or re-exposed, that you have a quicker, more robust antibody response to that. But if you definitely had the infection, it's very possible that you would still have antibodies.
Melissa wants you to clarify where the 100+ cases are coming from today.
Well, I can't really say specifically. Like I said, I did glance at our database, and in these 3 or 4 nursing homes, just at a first glance, appeared to have significant more cases than they did when I looked at it on Sunday.
Had another question earlier from Shannon. It's been reported that this is going to be the deadliest 6 weeks of the pandemic. Is that true, and what factors make it so?
Well, I don't know that you could predict that. I know there's a lot of concern that we're going to have a lot of increases just because of the change of the weather. One of the things I think it has been borne out that you're less likely to spread the disease if you're outdoors, and for a variety of reasons. You have more the fresh air, and it's easier to spread out. And we're entering the time of the year where much more of the activities are indoor activities and close quarters, and maybe without good ventilations. So that there is, the concern that we will see a spike in cases. One thing I hadn't mentioned before that one of the things I think we can be real proud of in Garland County is our school systems. They really worked hard and planned and continue to do this on a daily basis, and so the percentage of our positive cases in the school age groups is actually low and going down, and so I think that there was definitely a lot of concern about bringing more people, more students and staff together, that we would see big spikes within the schools, and at this point we haven't. And then I think we're there. Our educators really need to be commended for doing all that they're doing to prevent that.
We're seeing reports of a resurgence or a second wave globally in Europe. What can we learn about the virus from that? And did America ever really get out of its first wave, or does the idea of waves even really matter?
Yeah, I think that's a difficult thing. I think there's some textbook things in terms of following a pandemic or widespread infection, and I don't think that this is really following the textbook necessarily. I think that we've done a lot to kind of mitigate the spread, in terms of kind of really shutting things down and then really putting a push on good hygiene and facial coverings. And I think that's probably, that's definitely reduced the amount of infection that we would have if we haven't instituted those things. But unfortunately, those haven't been followed universally. And so we're still seeing the spread. Sometimes, to really look at surges or spikes, you almost have to do it in retrospect after you kind of get all the data and see that. But and it varies from state to state, country to country, and even within a state. I think our trend in Garland County, we at this point we hadn't had a second surge. We may be starting to see that, because we had our surge back in July when we went 2 or 3 weeks in a row where we had doubling of our cases each week, and we've been on a plateau since then. And I'm hopeful that these hotspots in the nursing homes, that those are kind of defined areas that we can really concentrate on and identify and stop the spread by as opposed to having a lot of cases and it's kind of spread out around the county and not having as much control over the contact tracing, and that actually brings up something that has been a concern, something we talked about quite a bit at our our meeting on Monday is the difficulty in contact tracing that we've had in Arkansas. There was a report that came out over the weekend that about 20% of the positive cases, the contact tracers are not able to identify them, they're able to identify them, but they're not able to contact them, and then they're being listed as unreachable. Both the people that are known positive and then the close contacts, and if that really diminishes the effectiveness of contact tracing. So the word that we're really trying to promote is answer your phone. We've got, it's really at least 3 different entities that are doing contact tracing under either with a health department, and then they're contracted with 2 private companies, but they can't be, you can't do effective contact tracings if people aren't accepting when they are contacted. So I think that's a message we really need to get out. Answer your phone if it's somebody you don't want to talk to, or it's not somebody from the health department, you don't have to talk to them. But in order for us to really use this tool of contact tracing, people have to cooperate with it.
One thing I've heard of a lot of people doing that might be helpful is saving the numbers for the contact tracers in their contacts under that in advance, so they know who it is when they call.
Well, in theory, that would be a good idea, but unfortunately, I think they've got one like a phone number 833 COVID 2019. I think that one of the groups that's doing the contact tracing. But some of it, like the local health units, when they're doing testing and they get the results back, and then they're calling people as soon as they get the results back, and so it's the local health unit that's going to be the number for the initial contact. So and unfortunately, there's not one single number, or even 2 or 3 specific numbers. So I think in order to really improve this, people have to take a chance and answer.
Yeah, it's just easy to hang up if it's a call you don't want.
Right.
You'll know in a couple seconds. So earlier this month, the president contracted the virus. He was given a number of drugs for treatment, including dexamethasone, remdesivir, and Regeneron. Do you think we'll be hearing about those drugs in the future? And if so, can you kind of explain what they are?
Well, the dexamethasone or the steroids, that I think has in some people shown to be helpful. Of course, the steroids have been around for a long time, and routinely used in respiratory infections. People even just regular pneumonia or asthma or things like that, and so it does improve some lung functions by reducing the inflammation in the lungs. So that's kind of a standard treatment. As far as the specific antiviral medications, I think that they're being developed and will be helpful and useful. As far as the monoclonal antibodies, those that the president was given, I don't really have a lot of specific on that, and I think it's probably being studied, but it's certainly kind of an experimental treatment at this point.
Got a couple of good live questions about compliance. First is from Mike. What is the best way to get high school and college age students to comply with the face covering mandate? Way too many no longer following direction.
I don't know there's an easy solution to that. I think probably the best thing is those age groups. I mean, their peer pressure is a real thing, and one of the things we talked about at our meeting this Monday. It said, if you go into a room where people aren't wearing masks, you got to say something. Don't just pretend like they do, or just don't pretend like it doesn't matter. Make a point of saying something. I use the analogy of what over the years we've done with smoking. Certainly when I grew up, and for a long time, there were no smoking, indoor smoking restrictions, and then they started having smoking sections in airplanes and restaurants, and then finally, especially here in Arkansas, when we passed the Clean Indoor Air Act, pretty much banning smoking from indoors. But I can remember after that passed, you'd still see people occasionally would smoke, and people would just kind of ignore it or move to a different table. But now I think if someone lit up a cigarette in a restaurant, that people wouldn't stand for it. And so I think that we need to have the same thing about facial coverings. If you're in a restaurant and somebody's not following the regulations, complain to somebody or just leave. But I think peer pressure is going to be a real important part, especially in the age groups that you mentioned.
Even though I'm not a smoker, I get these targeted ads every time I watch YouTube about the dangers of smoking and vaping, and it seems like a missed opportunity that those haven't happened for wearing masks yet.
Right.
Someone should take advantage of that. Got a question from Taylor. It seems that everyone is getting fatigued from having to quarantine, even though our cases are much worse than they were in the beginning. Is reopening the main causes of the cases going up so much? And what is your opinion on closing things down again?
I don't. It's really hard to determine exactly, why we've seen an increase in cases. I know that I don't. It's certainly here in Garland County. I really feel like our spike is due to the nursing home and the frequent testings in the nursing homes. As far as opening things up, I don't know if I have a strong opinion on that. I think we've got some really good mandates in place in terms of social distancing and wearing masks and hand washing, and I think following those is really going to be more the key than anything. I think just social. Social awareness and social responsibility I think that's going to really be the key to really stopping this pandemic.
And you touched on this one earlier, but just to reiterate for Susan, are hospitals at or near capacity?
I don't feel like they're at or near capacity at this point. I don't have any kind of specific numbers, but the reports that we've gotten at our weekly meetings, the hospitals report that they've seen a few more cases in the hospitals than they were, say, back during the summer. There was time in July and August, they had no COVID cases in the hospitals at all for a 2 or 3 week period. Now they definitely have cases in the hospital, but it seems to be a pretty manageable and steady numbers. But we just have to hope that stays that way.
All right, in the audience, I don't want to try and keep Dr. Shelby much more than an hour, but if you have any more questions, get them in while you still can. And again, we'll meet again, what did we say, the 19th, 3 weeks from tonight on a Thursday at 6 p.m. So if anything you don't ask tonight, hopefully it'll still be relevant, or hopefully it wouldn't still be relevant, but I don't think the pandemic's going to end by then. But we have a question from Melissa. How do doctors tell the difference between allergies, temperature change, stuffiness, and the virus? How do they know without testing?
I don't think you can, though. You have suspicion, but that's true of it, kind of any diagnostic episode that you have when you're seeing your doctor. You have to kind of take the the history. If someone has allergy symptoms every year at this time and they're not running fever, you can. Unless there's something else that is concerning, you can it probably is allergies, but that's one of the difficult things with this particular virus is that it's not specific enough that you have to kind of look at all the diagnostic evidence and make a diagnosis, and so we're fortunate that we're getting more capability as far as doing the testing, but you really can't do it with even just with one test, because you can have allergies and COVID. They're not exclusive.
We have some major events and holidays coming up in the near future that's going to result in people coming into contact with each other a lot. What can people do to stay safe and minimize exposure, starting with Halloween this weekend?
Well, I think most of the organizations are making adjustments, and I think individuals are making adjustments that we can't do the things on this Halloween that we've done in the past. We can't have groups of people together. I know a lot of organizations have maybe come up with some different things that people can do and stay safe. But whatever you do, you just got to keep in mind that when you come in contact with people you don't know, or not non-family members, you really just need to assume that anybody has COVID, and act accordingly. I think that coming up with Thanksgiving and Christmas, you got to accept that it's different this year. It's not going to be a good idea to have 40 or 50 people in a enclosed environment, especially people traveling, coming from other places, or people that you only see once a year or twice a year. I think that the wise thing would be to make some adjustments and just accept the fact, when nobody likes it and nobody wanted it to be that way, but you have to kind of deal with the reality, and part of that dealing with the reality is probably changing plans from the way you've always done it, and I think that's going to be important. And again, it's going to go back to people being socially responsible for what they do, and that's the important thing. This has got to be dealt with, and it's hard to deal with, and people have to make sacrifices, and just can complain about it, but you still got to do it.
And then, of course, early voting is already going on. Election day is coming up Tuesday. The library, in fact, is going to be a polling location, and I feel pretty confident the Garland County Election Commission's taking good safeguards to make in-person voting as safe as possible. But do you have any reminders for the voters?
Yeah, I think what you covered the important things. I was very impressed with what they've done. I voted down at the convention center, and the way that was set up, it was so efficient, and it's such a huge venue there that I think they had 25 voting machines, but it was way spread out, and the poll workers were very vigilant about the way things were run. My hat's totally off for all the poll workers that they're doing that to, emphasize how important it is to vote, but how important it is to stay safe too.
Then, of course, the big holidays coming up, and Thanksgiving and Christmas, we talked about those, but shopping's coming up as well. People think they should kind of put more focus on shopping online when they can?
Well, again, that's kind of an individual choice. I think that we certainly in the last year, of course, online shopping has changed dramatically over the last few years, but it certainly accelerated this year with the pandemic. So, and I think the Black Friday sales and that kind of stuff is history. And I think the merchants are accepting that again, you've got to make personal choices to be smart in how you do shopping, and it's probably going to be different than you have before.
All right. Well, that's all the questions we have for tonight. Dr. Shelby, I'll give you the final word here if you want to send our viewers off with any message.
Well, it's probably kind of like a repeat of things, but people have to be smart and act smart and be respectful and really care about their neighbors. It's a real opportunity for Garland County and Hot Springs and to really kind of work together. I think we are, but we've certainly got a ways to go, and I can't emphasize enough how serious this is. I mean, we've got people dying every day from this terrible disease, and we can say we're tired of it, but it's not tired of us. So we've got to work together.
Thank you for that. Well, this was very informative, and it was a pleasure once again. I'll be seeing you again November 19th. That's a Thursday, 6 p.m., 3 weeks from tonight. And to the audience, if you want to get any questions to me in advance, you're welcome to do so, or you can ask them live like some of you did tonight. Either way is fine with me. And until then, everyone be safe and take care.
Okay. Good night.